I'm Janelle,
Alisha,
And I'm Birk.
and we are undergraduate bioengineers from Stanford University.
26,500 patients in the U.S. perform peritoneal dialysis, or PD, the at-home dialysis that utilizes the body's peritoneum as a natural exchange membrane. Because there are many steps involved in setting up PD, there's a high risk for touch contamination and eventually peritonitis, or scarring and inflammation of the peritoneum. The current standard of care for treating peritonitis is the patient self-reporting symptoms like abdominal pain and cloudy effluent fluid, and then sending a waste sample to their PCP for a culture, which takes 48 hours. About 13.5% of PD patients in the US are hospitalized for infection each year, which costs $3,800 per patient per year. Due to increased peritoneal scarring from delayed detection, they must switch to hemodialysis, which requires 3 weekly dialysis center visits, has higher costs, and isn't the preferred dialysis for many. We aim to design a quicker, more reliable, and inexpensive way to detect peritonitis before PD patient awareness in order to treat the infection earlier. This will reduce acute hospitalization costs and prevent scarring of the peritoneum, improving PD longevity. Our device, the OpticLine, notifies PD patients of peritoneal infection by measuring the optical density of white blood cells in the effluent fluid using spectrophotometry. An LED will shine through the tube containing the effluent fluid, and a photodiode on the other side receives the signal. In the presence of white blood cells, the light is absorbed and not received, thus indicating proliferation of white blood cells. The device will perform routine measurements every night the patient performs PD, comparing the values to the patient's healthy baseline. If there are significant differences in the number of white blood cells over time, the device will urge the patient to send a sample to their PCP. The OpticLine not only has the ability to detect infection earlier, it will also decrease the burden and responsibility on patients to evaluate subjective data. PD patients will benefit from being able to perform PD for longer, up to an estimated 10 years. Likewise, hospitals and insurance companies will save money by having infection caught before it worsens, therefore reducing hospital visits and treatment costs of peritonitis. To test our prototype, we measured the optical density of multiple white blood cell concentrations diluted in mock PD effluent fluid on both a lab-grade spectrophotometer and the OpticLine. We detected a significant difference between normal and infected concentrations. This result supports that optical density interrogation methods are a viable way to detect infection earlier in PD patients. With the OpticLine, we hope PD patients can enjoy the social, clinical, and financial benefits of PD for much longer.